Okay, this is regular snoring. And yeah, that sounds like obstructive sleep apnea. So this is a good example. If you listen closely, you'll follow for obstructive apnea, there'll be pauses followed by gasps of air. And that's a big red flag. Regular snoring should be consistent and rhythmic, but if sleep apnea is an irregular pattern. So if you suspect that you have sleep apnea, you should seek some professional help, because if left untreated, it can cause serious health issues such as high blood pressure, or sometimes increase your risk for heart problems such as heart attack.